about 8 years ago, and it was based on being my mom's caregiver. My wife and I were my mom's caregiver, and so we're both from the telecom industry, from the telecommunications industry. Spent quite a bit of time there, and my mom started having a lot of problems with dementia. And especially with the telephone and with ordering things on TV. After she passed, I realized, there was nothing like this, nobody doing anything like this. There was nothing available to try and help these folks. And so that was the impetus for starting the company. So as I'd mentioned, nobody else has joined here. But as I'd mentioned, so yeah, we're headquartered in the DFW area, or in the Dallas area. So I guess we're in the second largest state. But I was looking at the size difference, and it's amazing how much bigger Alaska is in landmass. It's over twice the size of Texas. It's just pretty unbelievable there. So I will go through a short presentation to talk about telecom and the different features and how we've taken it to market. I will say that when I had spoken with Jacqueline several months back from when we met, we had no Alaskan customers. We were in 49 states. I did have to update that slide this morning because we are now in 50 states and Washington, D.C. So we did get our first Alaskan customer about a week ago. And his mom is in Nikiski, Alaska. So he's really looking forward to what we can offer for his mom to help her stay at home in her own home longer. So we're looking forward to doing that, and of course, getting more Alaskan customers as well. So I will go ahead and share out my presentation here real quick. All right. Are you guys able to see that?
Sure can.
Okay, great. Okay. So as I said, my name is Tavis Schriefer. I'm one of the founders of teleCalm. teleCalm is a veteran and woman-owned company. I spent over 10 years in the military, and my wife and I are two of the three founders. And so teleCalm provides a caregiver-managed phone service that stops problem calls for families living with Alzheimer's and other cognitive challenges. For the next few minutes, I'll tell you a little bit more about telecalm and how we're making a difference in the lives of families nationwide. So, as my mom's caregiver, I learned a lot about the challenges associated with dementia. The incoming scam calls did cause her a lot of anxiety, but the biggest problems were the outgoing calls, buying things from TV ads, calling repeatedly at all hours of the night, plus the inappropriate 911 calling. Now, these are all extremely common problems for millions of seniors suffering from dementia. And that's why we created telecalm, to stop these problem calls, reduce senior isolation, and to reduce family stress. Now, TrueLink Financial reports that there's over $36 billion defrauded from seniors annually, and 70% of that actually involves the telephone. 18% involves a family member, a friend, or an ex-paid caregiver. And with over 10 million calls processed so far, telecalm has been successful in stopping all of those targeted fraud calls for our families. So all of this is with our home phone service that's available now. We're currently in beta testing for our telecom mobile service, and that provides all of the features and benefits of that landline service, and it'll be launched commercially later this year. We do continue to roll out more beta testers every month for the mobile service. But so far, everyone, all the active customers really are on the landline style service. So at the heart of our service is the Caregiver app. Family caregivers subscribe to our phone service for their loved one, and then they manage that service remotely through the Caregiver app. With teleCalm, calls from trusted contacts pass straight through, while suspicious calls and known bad guys are blocked immediately. Now, using that Caregiver app, the family caregivers can prevent all the bad calls, even the problem calls the senior makes due to their dementia. So among these problem calls are false 911 calls, which is also a major issue in senior living communities. Currently, 52% of our end user seniors that live in senior living are making or attempting to make unnecessary 911 calls, which we're able to block or reroute to nurses' stations. Now, we also have a 911 solution for those living at home as well, and I'm happy to talk about that. But most of our family caregivers subscribe to our service to stop outgoing call problems. But they also love the fact that we block 100% of the incoming telemarketer and scam calls as well. The bottom line is we stop all the bad calls, both incoming and outgoing, which is about 62% of the calls per month. So we currently provide service to seniors in over 750 senior living communities and in private homes in all 50 states. That's the slide I had to update with our new Alaska customers. So in most cases, family members subscribe directly, and they set up the adapter in their loved one's home or in their senior living apartment, even in memory care where they may not be able to have a telephone otherwise. Setup takes about 10 minutes. It doesn't require internet or Wi-Fi, but it can use available internet. And in senior living communities, we don't touch any of their phone wiring. So all we need is a power outlet. So it doesn't matter if they've got phone lines going into the rooms or not. That's not an issue for us. Now, many times, caregivers don't even think about landline solutions. They jump to a cell phone or trying to get an easier cell phone solution. But traditional landline style phones provide many advantages for the senior, both in private homes and in senior living, especially if they have dementia. As cell phones become more confusing, these seniors can continue using landline style phones because it's a technology they grew up with. Now, the latest figures show there's up to 10 million seniors with cognitive challenges in the US alone, and that's about 18% of the senior population. 70% of these seniors continue to live at home. And according to the Alzheimer's Association, 42% of all senior living residents have some form of dementia. Now, today, telecom's home phone service is focusing on groups with Alzheimer's or dementia-related challenges. Now, our telecom mobile will bridge the gap between the landline and cell phones, and that will help other groups with other cognitive challenges. Now, having said that, we do actually have customers that are autistic. We have some that are intellectually disabled. We do have some that are going through chemo due to cancer, and therefore they're having these same types of symptoms. We also provide numerous Parkinson's disease, and then we also provide services to battered women's shelters, to unaccompanied minors dormitories where they are awaiting citizenship, and even a couple drug rehab centers as well. So a lot of people have found ways that our service is helpful beyond our focus. and we're happy to help anyone we can for that. Now, we believe telecalm is simply the best choice for caregivers. While other companies offer some degree of scam protection, only telecalm stops outgoing call problems and restricts those calls to only trusted contacts. Now, we offer 3 levels of service. Our trust service is really the best choice for independent seniors who just want as close to regular home phone service as possible. It has some robocall protection as well. And these are primarily people that are living in a senior living and don't necessarily have cognitive issues, but they do want a landline style phone. It's not intended for those with cognitive challenges. Now, our caregiver service, that's our flagship service, and that's what most of the families select. With this service, this is the service that I've been describing in this presentation. And with this service, it includes the caregiver app, and it solves those late night and repeated calling issues, the outgoing call filtering, and the restrictions for incoming calls by only trusted contacts. Our priority response service is an add-on to that caregiver service, and it's for seniors who are living at home in a private residence and who have a 911 calling issue where they're calling 911 unnecessarily. And with that service, their 911 calls go to an EMT call center instead of going straight to the 911 operator. And that EMT call center will triage that call, talk to the senior, figure out what's wrong, and then they will contact the families to see what they would like to do about it as well. All of our services are month to month. There's no long-term commitments. We have a 95% customer satisfaction rating, and all of our support team have been family caregivers themselves. So we don't outsource to overseas call centers. Everybody that they talk to here can actually relate to issues that they are going through as families. Now, we utilize 3 marketing channels to reach our customers. The largest is our direct-to-consumer channel. Now, this includes affiliates and professional referrals like attorneys, financial advisors, care managers, and others. It also covers a broad range of cognitive challenges in multiple age groups. We also have a senior living referral channel that involves communities distributing our brochures to residents or to their families upon move-in or when needed. Now, this benefits both the residents and the staff, and the senior livings are not compensated for this, but like I said, we're in over 750 senior living communities. Most of them, that is what they're doing. So their compensation is just the help that it provides both their staff and their residents. Now, we also have a B2B channel where we partner with communities and they offer telecom service as part of their residents' amenities. Now, in those cases, we bill the community directly, and then they provide the direct support or the phone service, to the families or to the residents. And we still can provide direct support to the families as needed as well. So customers tell us that we've made an immediate and life-changing impact on their lives, and they only wish they'd found us sooner. So I invite you all to help us improve the lives of millions more. And I do appreciate the time today, and I'd be happy to answer any questions you have about the service.
Thank you so much, Tavis. I really appreciate it. I would just ask Denise, that was an excellent presentation. Denise or Marty, do you have any questions?
Go ahead, Marty.
No, I was just unmuting. Go. You raised your hand. I'll let you go first.
Okay, yeah, no, way to go, Tavis. Way to go. I really like what you've done here, and I think it's super important to a really vulnerable population. One thing I was thinking about is, have you reached out to like government agencies, like the Department of Health? Where are you guys with that? Because I would think that this is such a beneficial, given that Alzheimer's and dementia is a huge issue for all of us. I'm just curious, what state governments might say about using your product.
Mhm. We have not. I mean, I think it's an excellent idea, and the closest we've done for that is with the area agencies on aging. We've reached out to the various areas of agency on aging, and we've done numerous presentations. But unfortunately, what we've found with them is, for the most part, the population that they're referring to us are low income and really are looking for the low cost phone service. That's really what they're needing: low cost phone service, low cost internet. We are not eligible for those government programs. We're not eligible under Medicaid, and we don't really consider ourselves as a low cost service. We're not trying to compete with that. We're trying to actually solve an actual problem beyond that. And so that wasn't the right avenue for us. But we do get referrals from police departments that find out about us because of the 911 issues, or frequent, they call them frequent flyers, people that are calling quite a bit. So we do get referrals from them, but we don't have any we haven't taken any formal actions to do that, but more than willing to do it. Yeah.
Yeah, Council on Aging was totally appropriate. That's good. Okay, thank you.
Mm-hmm.
Yeah, ironically, I am with the Alaska Commission on Aging. And when I saw this topic, even though I've got a meeting rolling down on me, I wanted to attend this. I got back a couple minutes after lunch. That's being a little bit late, but having had a father-in-law who got sucked into a crypto scam and only lost 16,000 instead of 300 like he was planning, this topic interests me very much. The other thing, I think that Alaskans are being targeted at a higher rate. I carry a Florida phone number as my personal phone, and I just get dumb, telemarketing calls from that. But on my Alaska work phone, I get those insidious texts once, twice, 3 times a day that say, "Hi, how are you?" Or, "Jolene, I haven't heard from you for a long time," or, "This number is in my contacts and I don't know who it is. Can you let," and those are the fish, those are the lures that they use to catch the fish. So yeah, this is near and dear to my heart. We're going to be launching a podcast in the near future, and I'm looking for topics, and this would be a great one, of having a tool where you can actually entrust your loved one with, my parents-in-law love their cell phones. My dad hates, he just wants that old phone that's attached to the wall, and it looks like that's what you're already set up with is,
Yeah.
Cordless phone. So kudos to what you're doing. It's going to fill a niche. If you could send me any information, print or electronic, that you have, I would love to get it.
Sure.
Do you want me to put my email in the chat?
Sure, that would work great. Yeah.
Okay. Yeah.
And we do. So we provide PDFs as well as physical brochures. We can certainly FedEx you brochures if those are helpful for you. But I can send you PDFs and you can look at those as well and decide, which ones you'd like or anything like that.
Yeah, send me PDFs, and then I'll let you know. Actually, I'll just put my address in the when you send me the PDF. If you're going to send me something, then I'll just give you my address then. But yeah, I feel like, and the Commission on Aging, we don't have a product except for the State Plan on Aging to get the Older Americans Act funds in the door, but we advocate for seniors, and I try to be aware of as many things as I can, because there's a lot of fires. We get a lot of calls every week saying help. And I have in-laws living in our downstairs who my mother-in-law frequently walks up the stairs to my wife and says, there's this person on the phone and I don't know what to do. And I sure would love to get rid of those.
Right.
So.
No, I agree. Thanks, Marty. I mean, it is a really bad problem. I had no idea until Jacqueline had sent out some links. I had no idea that Alaska per capita has the highest number. I know that that the Dallas area has for the mainland U.S. or for the contiguous U.S. Dallas is in like the top 10 for the entire U.S. for the number of scams and all that. I mean, we get them all the time. We get them in our work numbers, which is a 800 number. So
yeah,
why are you scamming a toll-free number? That I don't. It defies logic, but still.
right.
But yeah, it happens a lot, and we've been doing this for 8 years for the landline phones. You know, we do plan on having the cell phone version. It is Android right now. It's for Android phones. Until the recent update for iPhones, there was no way we could make an iPhone version. With the newest update, there is light at the end of that tunnel. So we are looking at developing an iPhone version as well. But first, we're going to get that Android version out the door. And it's, you know, the people that are using it really love it. But honestly, all it's doing for us is allowing us to help someone earlier in the process. At some point, they're still going to just move into that landline service because at some point, they don't charge their phone or they forget how to use it or they misplace it or you know, or somebody in the senior living stole it, which, you know, happens a lot. So in that case, those landline style phones really help, and they add about 2 years onto the time that seniors with dementia can continue using a telephone.
Cool. And they're less likely to get stolen, I assume.
Yeah, they don't walk off as easily. Yeah, but it does happen.
Marty, it's been wonderful to have you. Denise, go ahead and
Oh yeah, I just wanted to ask you one more question. Tavis, I know that you said you're a veteran and women owned. Have you reached out to the VA with this program as well? That just seems like a perfect group to help.
Right. It is something that we have looked at. We are, you know, by all of our employees being former caregivers and themselves, we are a relatively small business, especially for the thousands of people we're maintaining. So that it's been an issue, honestly, for us to have take advantage of all the different opportunities that there are. Initially, as a company, we did take on investors to help us get started. We stopped doing that once we reached profitability. We didn't want to just take on more investors and more money. So instead, we're concentrating on growing the business right now and then hiring more people to enhance that growth. So that's kind of where we are today.
Well, I'm just wondering, just because both Denise and Marty in particular, but I as well have contacts with the people who serve seniors. Perhaps we can continue to just use your PDFs and do some outreach, and I'll certainly be sharing the recording. Marty, if that would be helpful, I'll probably have that done by next Monday, and I will just link you to the recording from the YouTube channel. So,
yeah, that'd be great.
All right.
So I just want to say thank you, Tavis. That was an excellent presentation. Again, a small audience, but a valuable audience, because I think we can take this and really share this throughout our community. And I am excited that you're working already with an Alaskan, and they must have Googled you. They must have figured out that they had this problem. So I do think that idea of maybe working with police and reaching out to them might be a good strategy. So perhaps I'll talk to the Ardors and other places in Alaska to see if that's something that people in the community want to do. So.
Okay, no, I appreciate it. I'm happy to talk to anybody that wants to ask more questions, or wants information on it. I mean, that really is how we get most of our customers, is word of mouth from trusted individuals. Versus we're not a big sales organization where we're going out and spamming people, which is kind of the exact same thing we're trying to stop, right? So.
Right. That's awesome. Well, thank you so much. Thank you to Denise and to Marty for attending today. We have the next Open Innovation will be on November 16th. That will be with Avonlea, which is a company that's providing a caregiving app for seniors. So that might be of interest to you as well. I look forward to you to connecting after this. And thank you, Tavis, again.
Well, thank you so much, guys. I appreciate the time today. All right.
Thanks, Tav.
Yes.
All right.
Tavis, I'll follow up via email. Thank you so much, everyone.
Thanks.
Bye-bye now.
Bye-bye.
Take care. Goodbye.